In this next section, we will cover a few special patient situations to be considered when charting home meds. For these special patient situations, it is important to remember to update the information source in the Compliance tab. You will also need to add a communication entry for these patients. These include patients that are nursing home residents, discharge readmit patients, transfer patients, and patients that arrive when OneChart is not working, commonly referred to as downtime. Nursing home residents typically arrive with a packet containing their nursing home MAR. Medications listed on the nursing home MAR are considered to be home meds, so they will all need to be documented. This includes any PRN meds, even if they haven't been taken in the last 30 days. It is important to note that insulin and other injections may be recorded on a separate MAR. Be sure to thoroughly check all nursing home documents to ensure you have included all of the patient's medications. Remember to update the information source for all of these medications to indicate it came from a paper chart, and then type in medications obtained from the facility's name's MAR in the compliance comments. Add a communication entry to the home med list stating which nursing home the patient resides at. For patients that were discharged and then readmitted from one Via Christi facility to another, chart the original home medication list that was obtained during the admission to the previous facility, even if some medications were discontinued or added as an inpatient. You can view the previous medication history by selecting the medication list from your menu options. Expand the medication history snapshot located on the bottom left. Select the date of when the medication history was obtained. After updating the home meds for the patient's current encounter using the Document Medication by History button, you will need to update the information source in the Compliance tab and add in the Comments section medication information obtained from the original med list dated, and then include the date. You will need to also add a communication entry that states that the patient is a transfer from the hospital's name and unit, and then please refer to Transfer MAR. For patients that have been transferred from an outside facility or hospital, you will again enter in medications that were on the original home med list only, unless the patient has been hospitalized for more than 30 days at the previous facility. If the patient had been at their previous facility for more than 30 days, use that facility's transfer MAR to document the patient's home meds. Again, you will need to update the information source in the Compliance tab and add a communication entry that states that the patient is a transfer from the hospital's name and unit, and then please refer to the Transfer MAR. For instances when our OneChart system is not functioning, you will need to document the patient's home medications using the appropriate form located in your unit's downtime box. If this form, often referred to as the yellow sheet, is not found in the downtime box, call the pharmacy department to obtain copies. In the last video, we will cover the final steps of documenting home medications.